I understand that there are significant concerns as a result of some rumor and information that's been floating around the community about the hospital system, and I really do appreciate the opportunity to be here tonight, update you on the process and the timeline that we're going through, and answer any questions you might have about where we are in that process and what that could mean to the local healthcare system that we provide here at Shore. Before I do that, though, I'll ask if, in an effort to put tonight's discussion in a little bit of context, if you'll allow me with just a few minutes of time to share with you the perspective which we're working under in the healthcare world as we know it today. And it really starts at the national level. I'm sure all of you are aware of the Affordable Care Act and the implications that that act has on healthcare nationally. That Affordable Care Act really tries to provide insurance for those who are uninsured and ensures that those patients who now have insurance can get access to services. Whereas at one time, if they didn't, they would use the emergency room in the hospital for those services. So I think it's an important part of the Affordable Care Act, and it's an important part of our nation's desire to take care of the patient's wellness in addition to just their emergency care. The other things that are going on at the federal level really revolve around quality and cost. Quality is paramount in the healthcare industry, and the federal government, in a variety of ways, is really enforcing that hospitals, local, small community rural hospitals, all the way up to the academic medical centers that treat thousands of patients a day, really focus on quality. And not only focus on it, but get reimbursed based on the level of quality that they provide. So I can foresee in the very near future, payers like Medicare, Medicaid, government payers, and commercial payers, Blue Cross Blue Shield and the local providers, will be looking at the quality outcomes that we provide in the healthcare industry and either reward us based on those high quality outcomes, or penalize us for those outcomes that are not high quality. So developing the system at the national level that focuses on quality is one of President Obama's main focuses as part of the Affordable Care Act, and that will transcend down to every hospital in the nation. Other issues that are going on at the federal level really revolve around physician shortages. We've all seen articles in the paper. We know that there are physician shortages in a variety of specialties all over the country. The biggest shortage that we're experiencing today is within the primary care field. So much so that there aren't enough primary care physicians to meet the need of the nation, especially as you add more patients to the insured field. That expands the need for primary care providers. So with our current shortage and with the expansion with the Affordable Care Act and getting those patients insured, we're faced with a shortage of primary care providers. And that's why the government, the state government, and local agencies like Shore Regional Health are looking at opportunities to expand who can provide that primary care service. So we're looking at other allied health professionals to help meet that need. But make no mistake, the physician shortage goes beyond primary care. It's exacerbated in the state of Maryland. Maryland is very tough with regard to physician recruitment and retention here. And there's a number of reasons for that. I won't go into those, but and also even within Maryland, in rural Maryland, it's incredibly difficult to recruit physicians to our community here in rural Maryland. So those physician shortages are real. They're going to continue in the future, and we have to think creatively on how we're going to cover that shortfall. And then also at the national level, there are organizations, commercial, private organizations, private companies that are starting to get into the healthcare world. We can see, again, on the news, you can look at Walmart, you can look at CVS, you can look at other companies who are getting into the healthcare world. And how does that have an impact on the hospital businesses locally? It's our competition now. It's our competition that's providing similar services to what we provide locally as well. So from minute clinics to some primary care services, all the way up to urgent care services that are being offered by commercial providers or private companies in our local areas, really causing the healthcare industry to be turned on a dime nationally. And that's got ramifications to us here locally. So let's take it down a notch for a second. Let's talk about what does that mean to the local, to the state of Maryland, and what we're doing here at the state. You know, the state really has its own unique payment system and process for how we manage healthcare here in Maryland. We have been granted a waiver that's almost over 40 years old, and that waiver allows the state of Maryland to provide healthcare services a little differently than the rest of the nation. And the difference really gets down to a regulated agency at the state level that controls what we can charge for hospital payments. Now, when you control the payments to the hospitals, you can also control how you're paid and what you're paid for. And over the years, over the past 40 years, the state's done an amazing job at regulating our industry, keeping us competitive with the quality that we provide in the healthcare industry in Maryland, but also keeping us competitive from the cost perspective. How much are we charging for the same level of services that other states are charging in the nation? We've been able to demonstrate that we are comparable, if not better than most states in the nation with regard to quality and cost. The challenge, though, that we faced over the last several years is that benefit has begun to deteriorate. With a shortage of primary care physicians in Maryland, with increasing costs for providing care in Maryland as provided by the regulatory agencies, our cost has gone up, and as a result, our quality has suffered. So it got so bad to the point where our elected officials at the national level and state level had to negotiate a modification to the waiver in the state of Maryland so that we could continue to operate under this one system regulatory payment system here in Maryland. Fortunately for the state, we were successful at modifying that waiver, but with that modification, it came down with very specific and very clear initiatives for the state of Maryland. And it really resulted in 3 major changes from what we were doing in the past. The first requirement with the new waiver that just started back in January of 2014, so we're just very new into this new process. The first criteria focused on hospitals expanding the scope of their responsibility. In the past, we've mainly focused on sick care, care that's provided in the regulated environment in the hospitals. With the new waiver, we are now responsible for focusing on sick care and well care, the care that keeps our patients well, keeps our patients seeing their primary care and specialists as needed outside of the hospital system, only getting diagnostic testing when needed. High quality care, but reducing the cost. So sick care and well care. The second of 3 major focuses really touched on the shift from volume to value. Before January 1st of 2014, hospitals were incentivized for the amount of work that they did. The more work you did, the more you got paid. And there wasn't as much of a focus on that work with regard to the value that you provided to the patient and the community that you're serving. So that had to be a significant shift to go from volume to value, because that's going to allow us to provide higher quality care at a much lower cost. And then third and finally, the new waiver implemented a plan that said we have to reduce the cost of health care in the state of Maryland. That is a requirement of the new waiver. There are specific dollars associated with reducing the cost of Medicare and Medicaid services at the national level, and we're held accountable to that performance as part of the new waiver. So sick care and well care, from volume to focusing on value, and then also focusing on reducing the overall cost. So as you can imagine, in my world, in the healthcare world, our industry has basically been turned on a dime over the last several years. It is a significant paradigm shift from what we were accustomed to and working on in the past. But even with this change, we see at Shore Regional Health, and even in the state of Maryland, as these challenges that have come forth to us have really been presented as opportunities for us to improve. So let me talk about what that means to Shore Regional Health, and if I could take it down one more notch. Shore Regional Health now has some very clear guidelines for how to operate a healthcare industry in the state of Maryland as a result of the Federal Affordable Care Act and as a result of the new waiver. We have clear guidelines, we know what our responsibilities are, and it's now up to us within our Shore Regional Health system to provide the best quality care we can possibly provide at the lowest affordable cost. That's the initiative from the state, and that's what our focus has been since the new waiver took place. So what have we done about that? Some of the things that we've done very, very specifically include putting together a strategic plan. Since we merged with Chester River back in 2013, we are now a 5-county, 3-hospital system that covers about 370 square miles, and that treats almost 175,000 patients within the 5-county region. So from northern Kent County down to southern Dorchester County is our region. All the way across to Queen Anne's, and to the east is all of Caroline County. That is our 5-county service area. That's what we're responsible for as our service area, and that's what our focus needs to be on. So with that region, our strategic plan was based on providing levels of care under the new rules for those 5 counties and for the 175,000 citizens that we serve. So how did we go about doing that? We first put together a strategic plan that gives us direction under the new guidelines and under the new rules about how to succeed. But one of the things we haven't done yet It's gotten down to the level of defining the services that we should be offering throughout those 5 county regions. We know what our mission statement is. We know what our mission is as an organization. We know what our vision needs to be. We know what goals we want to achieve. The next question is, what services do you offer and how do you accomplish those goals through the services that you provide? That is the exercise that we're undertaking as we speak. We're working on pulling together a strategic services delivery council. It's a council of the board of directors who is tasked with the responsibility of looking at and identifying services that we should be offering in our 5 county region over the next 5 to 10 years. It's important that we do that now because the rules have changed, and we need to make sure that the services that we offer meet those changing rules. So how are we going to go about doing that? Some of the key ways are that we will have each service line analyzed. So when I say service line, that just means something along the lines of orthopedic care, cardiology care, cancer care, those broad definitions of healthcare services that most community or academic hospitals offer. Those are the service lines that we're going to evaluate on a case-by-case basis. And the questions we're going to ask ourselves are, what are the pre-acute levels of care that we should be providing for each of those services, and where should we be offering those in the 5 county region? What are the acute care components of each of those service lines, and where should those acute care services be offered? And what about the post-acute care services? So pre-acute, acute, and post-acute. Let me give you an example of a pre-acute care service. That includes anything from education to the community about awareness. It includes screening exams for diabetes or for cancer. It includes primary health, primary care, so making sure that there's primary care appropriately situated throughout the communities, specialists care, diagnostic testing like x-rays, lab tests. All of that is under the umbrella of the pre-acute care.